Dr. Mauricio.
Thank you, and good morning. Thanks for coming out so early. So we're going to start with, we'll talk about dizziness. I know it's our most favorite patients in the clinic. I don't have any disclosures. All right, so our first job is to find out what exactly they mean by dizziness, because that can mean many things to different people. So does it mean that they're having this room spinning sensation, or is it that they feel lightheaded, like they're going to pass out? Or is it that they just feel kind of off balance when they walk? Or do they just feel not quite right or ill? I've had patients tell me they feel dizzy, and it really doesn't pertain to any of those three things. They just don't feel good. So once you kind of establish that, then you're at least on the right path, I think, to sorting out what they mean by dizzy and what's going on and how can we help them. So I'm going to start with the first case. This is a 67-year-old gentleman who comes to your office, and he's had this room spinning sensation since he woke up this morning, and it's persisted all day. Okay, so what finding would make you think that this patient is having a posterior circulation stroke as opposed to an inner ear problem? Is it that he's also having some pain in his left ear and some hearing loss? Or is it that when you do the Dix-Hallpike maneuver, you notice that he's got some upbeating and torsional nystagmus when you drop him to his left side? Or is it that he's telling you that he's got headache and nausea and vomiting associated with these symptoms? Or is it that he, on examination, has a Horner sign? So I think you already got the answer, so that's not fair. But it's D, it's Horner sign. So we'll skip that. So this man has a Horner sign, and what it is, you can see that there's some asymmetry in his lids. He's got ptosis on the right lid, and also some asymmetry in his pupils. His right pupil here is smaller than the left side. And the third component of that triad is anhidrosis, or loss of sweating on that same side of the face. So this would suggest that this man is having a brainstem stroke. And it's helpful in this scenario that there are some neighborhood signs. And you know, us neurologists, we like to localize things. It's kind of a game we play. But in this patient is having a lateral medulla infarct, also known as the Wallenberg syndrome. So it can present with acute onset of vertigo because we're hitting the vestibular nucleus here. But also we have some other neighborhood signs. The brainstem is a high-priced realty area of the brain, and so we might also have some difficulty chewing or swallowing because of interference with the cranial nerve nuclei of 9 and 10. Might have some sensory loss, cross-sensory loss. So on the same side of the face, you might have loss of pain and temperature sensation, and then the opposite side of the body